please. It's all yours.
May heaven. Thank you. 8h15, mais ou menos. Hello. Hi, everybody. Hi, friends. Well, I am very happy to come back to the Baltimore Spiritist Society. Half hour or just a little bit more to your question. To remember that we are dealing with one aspect of human life. Do you know, I know that we can live in this side of life when we are incarnated, but we have a big different world around this one, the spiritual realm. In terms of numbers, we have more or less 7.5 billions of people with physical bodies. So, in the material world, and we have 12.5 spirits without the physical body, living just now in the spirituality, in the other side of the life. Mediumship, do you know, is the understanding or the capacity to communication between both sides, between two kinds of people, the people that are living in the spiritual world and us. This is not only one spiritist aspect, because this is proper of our humanity, because in all times we are living in two different dimensions, and we need to stay in communication. But sure, when we are spiritists, we can study and we can understand very much more about this human condition. All of us, we are mediums too. Do you know? Emmanuel, by Francisco Cândido Xavier, tell to us about this. But we know that we have some kind of mediums with a very ostensive manifestation of the spirits from the other side. But in terms of living and communication, all of us, we are mediums too. But frequently, we are some medium with intuition, a very light mediumship capability. But we need to go on. This is the book, Roteiro, when we have the idea by Emmanuel of how much we are on earth. We are together, summing the two realities, 20 billions of human souls, human spirits, incarnated or not. Okay? And we are in communication. Well, we are here trying to obtain our inner enlightenment and the substitution of vices by virtues. This is the main aspect of our lives. But you know, in the majority of cases, the people of brothers and sisters around the world, they don't know about this. And we know because we have Spiritism to study and to give us another comprehension about life and expiations of atonements. Primitive words, regeneration, happy words, pure words, we will obtain those conditions in the future. And mediumship, it's like ferramenta, a tool to our moral development. Because, as you know, Spiritism begins after the La Table Tournante, the moving tables or turning tables. This was a very interesting and different mediumistic aspect, as I will show you another examples in terms of ectoplasmic manifestations. Spiritism, all of you are studying. And in terms of mediumship, we have the Medium's book. And we recommend, obviously, that all of us should study this book because we need to learn and we need to do our studies about mediumship during all of our lives, because we are changing, we are in progress, and we need to do some kind of continuous education with the basis of the Spiritism, with Allan Kardec books. You know about fundamental postulates, immortality, reincarnation, cause and effect, law, action and reaction, communicability of the spirits, mediumship. This is one postulate. This is one main aspect of Spiritism. Interview of the spirits in the physical world, intervention. This is some aspect of mediumship too. the existence of the spiritual world, the physical body, the spiritual body, perispirit, and the soul. All of that list of aspects, it is related to mediumship. Well, in terms of linking between spiritism and medicine, as a doctor and as a spiritist, I am dealing with this frontier, trying to use mediumship to help our patients. Patients with cardiovascular disease, but patients with all of the more important disease in terms of physical body, but importantly and very clearly, patients with mental disturbances, mental diseases, psychiatrist patients, especially patients with depression, with suicide risk, and patients with autism. The mediumship is the tool to enter the spiritual environment of those patients, to care of the spirits related to each of them. And when care of them, the patient in this side of the life, they have one different prognosis and different evolution. I will tell you one curious aspect. In the last November, I received a cell phone from a cardiologist, a professor of cardiologists, from one Brazilian city named Manaus in Amazon region. He was scheduling the people that will show the papers and the presentations in the Congress of the Cardiology in that region to all of the colleagues of that specialty in that year. He invited me to talk some issue in the Congress to our colleagues, 300 of them, all of them cardiologists. And I asked him, what kind of matter do you like that I could do the presentation? And I understand that he would like that I talk about coronary heart disease, acute myocardial infarction, cardiac arrhythmias. And then I listen. Your theme will be spirituality and cardiovascular disease. Do you know? We are growing up in terms of obtaining different frontiers in different specialties, as you will see till midnight. Okay? In terms of approach to the patients, in terms of some kind of spiritist medicine or medicine of the soul, because we need to change our focus. We need to continue to care of the physical body. For example, in acute myocardial infarction, to open the closed main coronary artery in the heart of the patient. This is the modern cardiology. But we need to do many other things. And we need to include completely our reality in the reality of the patients. Because all of the patients in this side of life, they have perispirit and they have one soul. They are one soul, okay? As you can see, this obsession or the treatment of the spirits related to the cases. This is one main consideration. But fluid therapy, passes, and astral surgery, we have in those fields another beautiful aspect in terms of researching about this activity, this frontier between medicine and spirituality. In terms of research in mediumship, we can do some kind of research, for example, in the Spirit Society. Each one, we can prepare some teams with a very good understanding and study about Spiritism and knowing about the reality to do some kind of research that could be useful to the human life. But can do it in image lab. For example, using MRI or function MRI to detect, to do some kind of evidence about some important aspects to the contribution of our understanding in many and many different aspects, related or not with medicine. In hospitals, in Brazil, in those days, we have so much groups with doctors, with nurses, with other health professions, trying to put in evidence the value of to include the passes to a better evolution of the patients. I know this only in Brazil, but in the future we can do it in each country. But obviously we need to respect the laws. We need to do a very good project, and this project being authorized by the commission that care of those things in terms of research. But this is an open avenue to benefit humanity. Do you remember Spiritism and all of that knowledge inside this doctrine is coming to us from the good spirits in name of Jesus, the governor of this planet and its humanity. Do you know? So we need to understand that all of this will going to see the progress during the decades, the centuries, the millenniums. Well, for example, research in mediumship in a spirit society, we can use magnetism and idioplasty to benefit patients. The patient in a hospital and the team at the Spirit Society. And I have some nice examples to show you passing midnight, okay? Let's go. Manifestation of incarnated people during mediumistic meeting. This is a research. Frequently and spontaneously, we can share, we can receive incarnated ones, independently of the country, the city, where they are living, by one kind of soul emancipation. Emancipation, I suppose, obviously. Obviously. Yeah? Thank you. Do you understand? The patients, he or she is in Sydney, Australia, or Buenos Aires in Argentina, but he or she is suffering of a very important disease, and we are caring of that patient at distance. And in some kind of situation, we need to bring the spirit, the soul of the incarnated patient, to receive some aspect inside the Spirit Center. Well, this is one field that we can do some nice experimentations and understanding of new aspects of the communication between incarnated spirits, incarnated souls, with the medium from in the team to help in terms of the health of the patient. We can study about ectoplasmatic materialization. Do you know? We have mediumistic phenomena of intellectual aspect, but we have the physical aspect of mediumship. And we need to understand vital fluid or ectoplasm, because this one, it is in the basis of the different manifestation, as I will show you in a moment. For example, if I study fluido vital or vital fluid and ectoplasm, we have many and many different books of researchers about this field. I would like to tell you, but I don't know about the time, but during 1 decade, I stayed 2 times by month with a very nice medium offering one very a big ectoplasm to nice manifestations. For example, the main aspect of that field of research and action from the spiritual reality to us, it was the materializations of spirits. I talk to approximately 20 different spirits, discarnated ones, men and women, youth and old one, doctors, physicists, and common people as we are. During that manifestation, the spirits comes, take the ectoplasm to some kind of surrounding their perispirit, and they becomes as you are now, as incarnated ones, but for a short period of time, but a short 10 minutes to discuss a medical case with a doctor, discarnated one. The name of him, my friend till now, Dr. Pedro Ernesto in Rio. I have the possibility, and I'm normal to talk about physics with Niels Bohr materialized in front of mine, and discussing modern physics, quantum physics, relativity theory, because many decades after the work he did decades ago. Do you understand? After a nice progress of the science named modern physics. And I don't know if I tell you, but I had the opportunity to know about different spirits, independently of the old profession and the people that are continuous in the research in the spiritual realm. But, for example, I have 6 children. 3 of them, they were doing the manifestation and talking with me. And decades after that meetings, I receive in my family 3 of them as my little girl or little boy. They are together. I can show you after this. We are telling about this for you because they are spirits. They are the same. They have the same specialization, and they have the same necessity to come back, and they can choose which family they will reborn. And 3 of that 20 spirits, they come and they are with me in my home from the last 20 years. I have no time, but I would like in another moment to talk about each of them for you. We have many and many books. Health and Ectoplasm. Research about mediumship. Ectoplasm. Materializations. Faces of the living dead. This is very common. We need to study too. What is that? Do you know this? In many spirit centers around the world, but especially in Brazil, we have some kind of history of that manifestations. This is one medium outside the body in some kind of trance. This is ectoplasm coming from inside her body. We have other people in the spiritual meeting, and this is one spirit creating one human materialization. This is an old photograph, but this is real. As I will show you, we'll have many and many different images about. All the same, ectoplasm, trance, ectoplasm, making possible those kind of materialization and research. I will show you some aspect. This is a scale, not in the pharmacy and not in the hospital. This is one research to put the spirits materialized, to compare the different weights from the medium without that ectoplasm and with the ectoplasm. This is a very sensitive electronic. This is one seat to the sitting of the mediums and the spirits with the verification of the weight of the patient. This is here. It's here. Do you know? We can do some kind of research with materialized spirits. We like to do this. And I am normal. This is one old photograph. Here, one soul outside the body. This is an incarnated one, and its spirit, its soul, with some kind of level of ectoplasm. Do you know the same face? When we are in the spiritual world, discarnated or sleeping, we maintain, in the majority of the cases, the face, the feature, yeah? I think if I show you that, we will sleep tonight. No problem in terms of be worried, okay? Or scared. This is one young medium in trance with ectoplasm coming to the outside by nose or mouth, frequently, maybe from the ear too. This is another medium. This is ectoplasm. He is in trance, and we have a very big group doing some kind of experimentation and research about ectoplasm. Do you know this man? Chico Xavier. This is Valdo Vieira, an old photograph. Here, Josefa, sister. This is one spirit, discarnated one, materialized by the observation of both mediums in the past. You can see that in your home? Frequently not. But we can have physical manifestation at home. It's not the case. Do you know? Different people, different time, but the same process of ectoplasm coming from incarnated one, doing one materialization. This is incarnated. This is a spirit that all of the people inside the room all can see that manifestation. This is the same, the ectoplasm. This is like a tissue. This is like cotton. We have different kinds of ectoplasm. Look at this. Do you know about one man in terms of who can identify one of them? This one. Our brother Divaldo Pereira Franco. Do you know he is concentrated? Everyone. Do you know some kind of white material coming from the mouth again? And this one. And this one. In the same meeting, ectoplasm to the spirit's manifestation, ostensibly because of ectoplasm condition. Do you know who is this? William Crookes, one physicist from England. And here, do you know this spirit? Who is that? Carol King. In a complete materialization, including the eyes. This is not common, because they do not frequently materialize the feet and the eyes. But this one, to one research by a physicist, a very famous one. Many researchers doing about this one, Charles Richer, Gabriel Delany, Aksakov, Bozano, Gibier, Geley, William Crookes, Frederick Zollner, Cesar Lombroso, Channing Knudsen in Germany. This is a big team of researchers in terms of this kind of mediumship, a very extensive manifestation with materializations of spirits. I would like to say my colleagues, because of that experience in Rio with that nice spirits. Do you know this one? Chico. This is Peixotinho, sixth 5 year before. Why I show you this? No mediumship here, but two nice mediums, including that other. This is Peixotinho doing one ectoplasmatic phenomena with the materialization of one woman. The same process. This is Peixotinho with another spirit. Do you know the clearly aspect of the face? This is the best one. And Chico Xavier in Pedro Leopoldo in Brazil, doing some declaration about that photograph, that being related to the two, because he was there and as a testimony of that mediumship process. This is a different group. In Rio, this is one discarnated one. Materialized. Incarnated spirit with ectoplasm. Dealing with surgery to help people. Patients going to the meeting to some kind of dematerialization of a tumor. One manifestation of the same spirit, do you like? Discarnated one. A doctor, a German doctor, doing the same in the same team to benefit patients during a half century with the same medium and the same spiritist or spiritual group. Here, Dr. Frederick von Stein, a discarnated German doctor. Do you remember? The same situation, another medium, Josefa, Chico, and ectoplasm from the mouth. Chico, Josefa e Josefa, a sister. Well, this was some aspect in terms of research with mediumship. Here we are 2 years ago, less than this. Effect, this is a paper within a medical presentation in a medical revista, magazine, okay? The effect of the Spiritist PASSI energy therapy in reducing anxiety in volunteers, a randomized controlled trial. This is the one example, we have many of them, utilizing the scientific methodology to show to the medical community about what we can do with the transfer of fluids and energy from the hands of the health professionals inside the hospital. This is in Brazil. And we can see the scientific approach, the controlled trial. It's not only one publication of one very basic level. This is another kind of level in terms of to try demonstrate the benefit of the passes outside the spiritual society, in the hospital. Do you understand the changing? Do you understand the invitation of my colleague to talk about spirituality and cardiovascular disease? But offering to my colleagues the true and important papers published around the world. This is the European Congress of Psychiatry, 14, Munich, Germany. The author, Rio, Spiritism, Spiritist Society. This the one subject, the submission of the abstract, influence of discarnated people in mental disease and its respective approach. How we can do it? Mediumship. We need to this kind of advancement of the medicine. We need the mediums. We have a treasure with mediumship to do that. Another congress, this was in Munich, Germany. This one in Madrid, Spain, September, the same year. The same paper, but with more cases, including to the presentation to expose to my colleagues about the experience. This is the best and more important congress of psychiatry in this world. And the merit is the merit of the Spiritism and Allan Kardec and the spirits, and the group that received this contribution and accepted them. Here we could talk about spirit center, spiritual reality, mediumship, spirits related to the mental diseases, to 4,000 colleagues from all the countries around the world. They look, they don't understand nothing. But I explain, I try to be clear, and this was as a beginning of bringing aspect from the Spirit Center to the psychiatry community. The same in another configuration. We can see around the world, Annals of Internal Medicine, the efficacy. This is one of the best magazines in terms of medicine in this world. The efficacy of distant healing. Distant healing, what is that? In medicine, it's a new one. Distant. The doctor, in the history of medicine, they are at bedside of the patient. Thinking about cure at distance is a very different. And Spiritism and Spiritist group, they have a very nice possibility of contribution to this field. For example, do you know about open cardiac surgery? Revascularization, for example. This is a very important surgical procedure. And we are dealing with a very important disease. Coronary heart disease and its complications, it's the main disease causing death around the world. So, if we do one research that colleagues did, we put 100 of patients with coronary heart disease being submitted to revascularization, and another group with same characteristics. Both groups received the best in terms of cardiovascular surgical procedure and the best in terms of modern cardiology. But one group received the prayer, the intercessory prayer, only to that people in the first group, without the knowing about who are receiving or not. And when we finish, the colleagues could see, for example, less mortality in the group that receive the prayer, less cases of reoperation. This is a complication. we need to put the patient inside another surgery with more complications in possibility. So we have some indications. For example, another one, the time of stay in a hospital was short for the group that receive this approach. And this prayer comes from Jewish, Catholic, and many other cultures and religions independently. And no one of them are Spiritists. So this is not one tendentious research. This is universal. To all the doctors understand the value of the prayer. The prayer is coming to medicine as meditation. We have nice papers to present to you about when the patients did meditation, the follow-up is different. The prognosis changes. Well, let's go. What is this? I think we will not have time. Oh. We need a technical. Sorry. Well, see, this is one spiritual approach. Do you understand? This is the field of the colleagues that change everything. So, look at this. This is a recent article. Neuroimaging during trance state. All of the people in a mediumistic action, they are in a trance state, with or without conscious. A contribution of the study of dissociation, another form to refer about mediumship is the dissociation, the soul from the body. And we can use some protocols of research trying to understand, for example, during psychography, what is going on in terms of the image of the brain of that mediums, and compare, for example, mediums with less experience in work in that field, with old mediums with better and older experience. And we can see the difference. And this one, this from Brazil, and we can see the magazine accepting this kind of research, putting the patients inside the resonance equipment to detect the change, and including to identify which kind of zones of the brain we can see the lightening when the patients, when the mediums, they are doing the psychography. This is a research in mediumship. This is one spirit. Yeah, one good spirit in one kind of presentation to the people that can see the spirits by clairvoyance. Okay? Well, in a recent publication in Scientific American, we can see this is another kind of research. We can understand that it is in Portuguese, but it's easy to put in English. For example, we need to understand about thinking. What is our thoughts? What is that? We have some kind of information This is a main aspect of life, of human life, and life of the other, not people, but the animals, because some animals, they can think too, but in another fashion, but they can do it. So when we analyze, we think in terms of the thought as electromagnetic irradiation. And it's very easy to understand because we have one ondulatory aspect of the thinking and thoughts, and we have the idea that we have a corpuscular nature of all of that electromagnetic irradiation, as, for example, X-ray, cosmic waves, microwaves, all of that, and light and colors, all of that, they are electromagnetic fields and irradiation from the origin of the phenomena. And we are understanding that our thoughts, they are as electromagnetic radiation. But in another field of research, we have one physicist, 30 years ago, Jacobo Greenberg Zilberbaum, doing one experiment, trying to put in evidence one quantum mechanism to understand the thoughts. And if I explain to you all the levels of the research, we can conclude that we have one quantum phenomena and not only one local phenomena. This is a very different aspect. And we can, when we study that, we can take some consequences of the idea that our thoughts, they are a quantum phenomena. But I think we will not have some time, maybe till midnight or more, we can examine all of this, and I would like to do it. We have the idea from Spiritism that we have, for example, the physical body, the perispirit, and the soul, to the incarnated one, okay? But when we study the André Luiz books, we can see some kind of advancement in terms of how to understand, for example, the mental body, the astral body, introduced to us Spiritists by André Luiz, by Chico Xavier. So this is one research to understand the levels of vibration of the different structures that we can have in the human reality. If we are dealing with physical body and duplo etérico, how in English, duplo etérico? Double? Okay. This is material bodies, but we have to study many other, and including the spirit itself. Perispirit, we can use this idea because this one is surrounding the essence of the spirit. This is another kind of field. Studying comatose patients with MRI, functional MRI. This is some kind of people. This is a publication of the best magazine in medicine in the world, the New England Journal of Medicine. So in this paper, we can see one kind of communication from the doctors to the patients in severe coma, without no one relationship with anyone around them. But this is one very nice aspect. I don't know how that colleagues have the idea to do that without Spiritism, because with will be different, but without, and they can communicate, and this is one very nice paper to introduce the medical people to the idea that independently of the brain in a coma situation, there is something that can communicate with them. What is that? The soul. They do not have some clear explanation to that. But this paper spread many doubts, and many other research is going on after this. The same journal, God at Bedside, treating about the idea of frontier between religious and spirituality, religious practice and spirituality and medicine. Should physicians prescribe religious activities, and some of them mediumistic activity? For example, passes and disobsession. Religion, spirituality, and medicine. Prayer as an interpersonal relationship, neuroimaging study. In terms of this paper, we can analyze the results, and the colleagues understand when they compare the prayer and the consequences of the prayer with a love relationship, with passion. The same areas of the brain are activated after the prayer. The people who is doing the prayer, they change their brain in the same areas and in the same intensity, comparing to the same people in love in terms of the children and in love of the wife of the other one. This is one kind of research. Brain activity in near-death experience during a meditative state. The neuroscientific study of spiritual practice. This is one review of the literature. I present this one in details in the Congress of Cardiology in Rio last year. Health and spirituality, we have many things to present. This is different hospitals in terms of spiritist activities to benefit the people. In the future, we will have passes as one part of the hospital to benefit the people. We will have one place to mediumistic meetings inside the hospital in a few decades in the future. This is one book that I could buy in the Metropolitan Museum of New York. I was there. During one, you too? Oh, yeah, a few years ago. During the December of that year, they present many and many different photographs from the spirits in terms of mediumistic evidence of survival. And this is a very nice book. I have one in my home, and I can show you in the future. We have the automatic writing, or spiritual writing, as you know. Do you know this? I was there with one medium in Rio, and for our surprise, he takes one pilot, one pilot pen, and begins to write. And we tried to read, it was impossible. Why? A mirror message. And he did it as we do the regular writing. And after this, how we can do the reading with a mirror. And immediately it was one message from one spiritual spiritual friend of that spirit society. This is the same. This is in Paris. I was there too. 2004. You are traveling so much. Yeah. Yeah. Me too. This is another message from, who is that? Leon Denis in Portuguese, talking about Allan Kardec. Do you know this? We can do research in this field. This is a friend of mine from Salvador, Bahia. Here we was in Milano, Italy. You was there?
No, we have a lady here.
Okay.
No, this is Medrano. Is this Andrew? No.
This is Florencio.
Florencio.
Yeah. Here, a friend from Portugal, from Italy, and he is in trance now, doing this painting. Look for this. You will see the same concluded in another photograph. This painting, it is in my home, because in another meeting in Rio with the same medium, my daughter Anna was in collective situations in terms of we can do as to Raquel, one patient, but we can care a group of discarnated people, suddenly discarnated, and rescue them. We are doing this one in the Spirit Society in the last 4 decades. And I would like to show you, but we have no time. This is the flies that goes down. Do you remember Malaysian Airlines? 2 different flies in a short interval of time. We care of that. Psychographies of the spirits being rescued by the good spirits, utilizing the material fluid, the vital fluid from the incarnated team. This is a very intense research to our knowledge about what we can do independently of the prayer, and how we can do as a research to see the benefit that promoted the mediumship team. But we have no time. Well, I think it's good to stop here. And I would like to listen about you, about your questions and doubts and contributions. I think you have experience in this field too, as a spiritist as you are. Maybe? Do you understand that we could do one more technical presentation? Do you understand? With one more scientific approach. But I understand that this is a very nice field, and I prefer to do some kind of light presentation in terms of some contents very easy to understand, to like, and to function as one motivation to the study of mediumship. Not only the theoretical study, but the practice too.
Thank you, Dr. Thiesen. If anybody would like to stretch a little bit, it's okay. Stand up if you wish to do so. If you wish to stand up, that's it. Okay, we'll get to that. I know sometimes it does help stretch. Yes, it does. So as Dr. Thiesen is saying, I mean, we all have, and when we mentioned, we all have this capability. We're always connected, whether ostensive or not. So we would like to pick his brains and ask her questions and make this, as he said, something practical that we can utilize in our day-to-day lives as well. So please.
Hi, I have a question about the mirror psychograph. What is it? The mirror?
The mirror.
Yeah, what was that for? I mean, why do they
well,
do it
this,
that way?
Yeah,
I'm not sure I understand it.
I'll try to explain.
Thank you.
Thank you for your question. Regularly, the mediums doing one automatic writing, they write as a common sense, as we do when we are writing something in the paper. But because of the idea that the medium are transferring the thoughts from the spirits, the good spirits, they can use the hands independently of the tendency of that medium to write. I know some mediums that can write texts and painting with the feet. I know some mediums that use one pencil, brush. Thank you. One with the right hand, and other one with the left foot at the same time. And two different painters doing the different results. So when we have one mirror automatic painting, is to the people present pay more attention of the phenomena. How one common people, or a woman or a man, could do that. In the contrary, because when we look at that thing, that result, we do not understand nothing. But immediately when we put in front of the mirror, we can see a regular text. This has one objective, that all the people, what is going on? What is that? Because commonly we cannot do that. Thank you for you.
Thank you. Paula, please.
Thank you very much. It was awesome. I have two questions related to your types of patients that you cited earlier. One question's very quick, and then the other I hope you can comment a bit on. With your cardiovascular and those with the mental diseases, you cited depression, suicide risk, and autism. Roughly what percentage of the cases you've worked with have the obsessing spirits with them?
How what, please?
What percentage, about how many of these cases also have the obsessing spirit that needs treatment?
All of them.
All. Okay,
All of them. This is a very important question. We do not have a cancer patient without spirits. Because cancer, we have here one karmic aspect from bad decisions and actions in the past lives. And in all that situations, we do some harm to the people in that occasion. So we establish some vinculation, some kind of connection with them. And the patient comes to another life in a reincarnation. He or she is reincarnated now, but frequently that spirits, they are in the spiritual reality, but they maintain some dark linking with the people with some kind of disease. Always. Why and how I can tell you in those terms? Because all the cases during decades when we open to help, we find spirits. With a very nice team of mediums doing that. And frequently, my colleagues in medicine, they are medical doctors and mediums too. Do you know? Yes. Frequently, they are my pupils in the hospital. And I invite them to work with us because they have mediumship and they have the understanding of the health and disease process. In terms of depression, all of depressive people, they have spirits too. Autism children too. Because all the cases when we open, we find spirits. And it's not only one, oh, I can see spirits, because we care of them. It was not to do one diagnosis of the spiritual presentation and existence linked to the case, but to care of them. This is one different medicine. So we can do what the present medicine should do to a better evolution, but we do something more that recognize the spiritual presence and care of them and guide them to a better sphere of life. When we do this, we can see different prognoses. Do you understand? That this is what I need, what I want, what the patient family want.
So part two, my other question was, today I was in a school. We spent 2 hours going over testing and educational planning for an autistic boy. Of course, we did not have a spiritual talk or mediumship. So I'm very interested in autism and its apparent increase right now in the world.
I know. One observation, 15 years ago, we had 1 children with autism to 20,000 other children in normal condition. 1 to 20,000. Today, last month, in the last statistic, we have 1 to 68 children. This is one exponential.
6 to 8.
Yeah? Do you understand the difference? So this is an issue to the future here to study together. What is that important disease with a very disability of that children and a very trouble situation to the parents? Well, in terms of spiritual aspect, how we can study and help the families and the patients with autism. This is one very nice and important, and in many different meetings around the world, spiritists and no spiritists, we are talking about this, autism. This is a possibility to be an epidemic problem, as depression is.
Thank you. Johnny, real quick, and I'll come to you as well.
Talking about autism and depression. So I give passes, but something I notice is like when people connect with me and come for the passes, I even feel easier the relationship to give the passes. Now, if somebody comes and to the center, but you notice the person doesn't have that understanding because I try to help. I always think, my gosh, I noticed that person came, it's years that she's coming, she's better. Then you know somebody from another family or inside of your family, not only they don't have the Spiritism doctrine and knowledge, they don't believe. I'm Catholic, and that's it. That's what happened to our family. We have to accept it. It's the way it is. So how do you help a person in your family that doesn't believe? Because when people believe, they come to the center, they read books, they do good, they help people, they change their way of thinking, right? But when you have a child in your family and the parents don't believe, or they believe the way they believe, with all respect, but, you know, I feel very frustrated. What I do, I pray. But how many things you could say, you could help, but all you can do is pray. So how do you face a situation like this when you go and you see a desperate mother, but you talk and talk and talk, and you say you can read this book, you can study Allan Kardec, you can go, and you notice the person is like in parallel. It's the person doesn't get you, doesn't believe. What is your approach when you go abroad, you travel everywhere, you just say, okay, what do you do?
Well, we need to help with the tools that we have. We need to understand that we will not have the possibility to help everybody. We should try, always. And we understand too that some kind of resistance from the patient or from the family is some kind of part of the process, because we are in a very limited situation in this world. This is a primitive or semi-primitive world. So we need to put our best feelings, offering them to the complete situation of each case. But we do not have the possibility to cure and to help in a profound level of helping everyone because of spiritual limitations and consequently the resistance to receive. And when the people are blocking because of a mental attitude, do not believing in that approach, we will have difficulties. Not only us incarnated ones trying to help, but the good spirits too. Obviously, all the team trying to help. But as you put in your question, we can and we need to pray for them. So that situation could change near in the future. I have a very interesting case of Charles. Charles was a little boy, 8 years old, in Rio. My old daughter, she is now a psychiatrist. But when she was very a little one, she likes to do dance classes. And one day, the professor, of dance comes to the class, very sad, and Joanna asks her uncle, in terms of dance, what's happened? And this professor tells to Joanna, my cousin, he is very disabled, and the diagnosis is autism. Nobody knows in that year what is clearly autism. So Joanna immediately tells to the professor, my father and I, a little one, in the spiritist and mediumship with me, Joanna. Our group always try to help. Do you like? My father and her group try to help your cousin? Sure. She takes the name, the address, and the age. That are the information that we need to help. Only this. Frequently we can take one photo or one video. I have many ones. I was trying to begin another part of the presentation with case studies. But in the future we come back. So the idea is the parents of Charles, they are Catholic, strictly. They do not could hear about Spiritism. And Joanna asked to the teacher, and about the parents, no talk about. Independently, because of the feeling of the professor, we open the case, we care, and in those days, that case was the first case of autism that we care, with a very nice benefit. Independently of the parents, that till now, they do not have the idea of what that team could done. They believe that the priests do the benefit. Sure, okay. It's okay. We don't care who did. Important the recovery and the benefit to the patient. This is our recompensa. Reward. Yeah, our reward to try to help the people. The benefit and a recovery in medical terms.
Thank you.
Okay, thank you for the questions.
Thank you. Yasko, please.
Well, because you said that you may say about this case of your family, that the 3 spirits that were before discarnated, I want to know what was the connection or the affinity or whatever mission, whatever was that your family was chosen to be the one to receive this. Is there something related to them particularly, or for you all together to do something as a team? I don't know if there is something.
Me too. But one of the cases, it was the case of Joanna, the psychiatrist today. We have in that meetings all the same spirits. And I know about them by their names. And one night, in one different meeting, a friend of mine, a medium, told to me, there is another spirit here, and she is linked with you. And my surprise, because as a spiritist, I don't know what kind of spirits are coming to talk to me. And the medium told to me, she will be materialized just now. It will be not one psychophonic manifestation. She would like to be materialized. And in a few half minute, one beautiful spirit, a Russian, with a complete aspect from Russia, a folkloric, do you know? It's a very colorful dress, beautiful blue eyes. And she comes to me and tells me, in Russian language, do you remember me from the fields of Russia? And I do not understand. Because if I was a Russian, it was in the past. And reincarnated now, I don't know more nothing. It is in me, in my memory, but she talked to me in Russian language, trying to provoke in me some curious situation. But after this, she talked to me in English. Do you not remember me from the fields of Russia? And I answered, no, because I didn't. So this spirit, her name, Matcha, it is Mary in Russian language. And she stayed in different participations, in different meetings during 2 years. And that spirit, Matcha, only comes to the meeting because of my presence in the meeting and talking always to me in English. After 2 years, he said goodbye. She? Eu falei he? Sorry. She said goodbye. And then 2 years more, I was married. And the first one was a little baby with blue eyes. When Joanna was 4 years, Father, I want to study Russian. I do not link one experience with that asking from Joanna. What do you want, Joanna? What is that? Russian language? What is that? She was insisting, yeah, with this with this question. And after 1 or 2 years, when I have a patient, a very old one, from Manchuria in China, but near the frontier with Russia, she talk in Russian. And I combine, I care of you, and you study Russia with Joanna. Joanna knows Russian language. When she was 7, Father, I would like to study violin. I love violin. But Joanna learned and studied violin to play this nice instrument. I think so, without confirmation, without. This is a supposition that Joanna is Matcha. Matcha is now Joanna. I don't know. I don't worry about that. This is one feeling. Joanna visited Russia 3 times. Well, I have 2 other, one daughter, Luisa, and 1 little boy, Vincent. I could not suppose their origin, but a group with my both sisters, they are linked to the same spirits that are incarnated during that meetings in materialization. And in 2 different occasions, the spirit named Zila, in which home we had all that meetings, Zila tell to my sister, my little sister, tell Sergio that that spirits are in their arms. And 3 years after, the same with Vincent. And telling who they are from that meetings. So I suppose, trying to answer, that group, they are composed of familiar spirits. We have many and many different reincarnations in the past, all of the people, all of us. So I understand that we are sharing that beautiful experience in mediumship group with materialization, because we are attracted themselves gradually to stay during 1 decade together, to reinforce the spiritual linking and affinity between them. All of them, we understand they are friends, and maybe more, they are familiar spirits. And they need to choose where they will come back, in which family, in which conditions, in another program, to different reincarnation. And for one reason, they could choose to stay with us. But the true mechanisms and motivations, I don't know exactly, but I understand in love.
Thank you, Dr. Thiesen. We are approaching 9 o'clock. We approached already, and we crossed already that mark. We still have until midnight, as he said.
3 hours more.
Three more
I
hours.
have 100 of slides more.
Any final questions so he can actually conclude for this evening?
About this collective drama, tragedy, you say that in your group, you help every time happens this tragedy. So could you tell us what we as a group here could do in these occasions? We think prayer, but is there something else? I know the Spiritists also come to rescue. I imagine like in family constellation that Divaldo describes different cultural, different people, different religion in the same time, how they go to the spiritual world, how they are rescued. But we as incarnate, how also we could help these different people with different religion, different beliefs.
Yeah. The prayer is the more important that everyone can do. Because we have a group constructed during many and many years. And we can share medical aspects, physical in terms of modern physics, magnetism, quantum mechanics, space-time curve, and spiritism in the basis. We can move those sciences trying to do the best to help. So that form to do the benefits to the people suffering some tragedies in the world is specifically to that group, but we have the notice, understanding of another group in Brazil only. But this is one technical approach to do a different movement to help the spirits. Because I learn about the spiritual reality and the suffering that we have after those tragedies. And we come time and different times to go doing some group to the capability to do that. This is one thing. All the spiritist groups, the mediumships groups, can help in some different manner, receiving 1, 2, or 3 victims of that tragedy. But depends of the scheduling of the meeting. How that group function to do something to that problem. But independently of this, all of us should and have the possibility to pray, independently of the comprehension, understanding, and the faith culture. But if we are spiritists, we have the gospel, we have Jesus, we have the understanding of the good spirits always with us, trying to reinforce, to stimulate the people to do the prayer to the people that are suffering. Because when we do this, we are doing one beautiful irradiation of good vibrations, and as we are incarnated, we put in movement to our fluids. This is a treasure to the good spirits. So if we are not experienced in those aspects of care, the prayer is fantastic. We, as I talked to you before, we are utilizing the prayer and meditation to medicine, to incarnate people with one disease in the physical body because they are incarnated. But now that people, they are disincarnated. So the effect, the efficacy of the prayer may be different to a better result. Don't understand only the prayer. No. Remember Jesus, to value the prayer in all the circumstances of life, and to benefit, to help, to care. We have a very important tool, the prayer, independently of what kind of religion we are linked.
Thank you, Dr. Thiesen. One final question so we can complete our evening.
This is an easy question, and it's on the same topic that you just talked about. Are you all receiving any guidance as to why these collective dramas seem to be increasing now? Maybe in relationship to Earth changes or something else as this planet is trying to evolve?
Some part of your question I didn't understand. Repeat, please.
Okay. I'm curious about the apparent or ostensible increase in the number of these collective dramas.
Yeah.
And has any guidance been coming through from the good spirits about that?
Well, our world are changing. We understand the idea of planetary transition. For example, the depressive disease and suicide, the autism, the cancer, and many other big problems are growing in our world because of our global situation in terms of our humanity. This obviously is true because this is one time to these facts occurring in a big statistically problem as we have today. It's not because of chance. We have cause and effect. These are the effects, and the causes are all because of our spiritual condition. So all that victims are being collected to be helped to change their minds and their spiritual condition. Trying to do a fast recovery to them. All that victims, they could stay in the spiritual world in bad conditions for decades. So we need to short the time of suffering doing that. But we understand that this is some kind of different approach after a century and a half of Spiritism. Because now we can do it. And in the future, we will do more. We will need to provoke the development of many and many other groups doing the same to benefit one quantity, one quantity of people suffering the world. This is as a seed. This is one seed of light from the good spirits to our humanity. And we need to see seeds of light in all around the world to a fasting evolutionary process to our humanity. But we have to respect the time, and we can do more and more to cause more benefits to the people. Okay?
Dr. Thiesen, thank you so much again for this beautiful enlightenment. We would like to finalize here. Do you have final words, or would you like to?
Thank you.
Please.
Well, I am so happy to this opportunity. I am thanking all of you, Danielle, Christian, and I think I will go tomorrow. I will take another flight to Cape Cod after Boston, and I have 3 days more of this kind of presentations, and I will come back to Brazil, to Rio de Janeiro next week. I am very satisfied, I am very happy to stay again with you. Thank you so much.
Thank you.
Bye-bye. Thank you.
So we can finalize this beautiful